Today's episode is a special one. We have here with us Dr. Amit Jilka, a clinician, mentor, entrepreneur, and the founder of Abbey House Dental in Staffordshire in UK, alongside Dr. Neel Ashar at Ashar Dental Care. Amit, it's wonderful to have you here. Thank you for coming here.
It's a pleasure to be here. It's nice to finally meet you all.
Oh, yes.
Yeah.
For the people watching us, could you let us know about yourself and your specialty?
So I'm a dentist. I focus all my dentistry on dental implants, similar to Neil. And I own 4 clinics in Staffordshire, as you mentioned, in the UK. We've been running those practices for the first practice we bought was in 2012. And then we've grown that team now to over 120 staff members. We have 40 plus dentists and clinicians that work with us as a group. And yeah, we're here to grow more. And we really try and emphasize on digital dentistry at our practices and building a very good training center. So we train a lot of our dentists, mentor them for dental implants, orthodontics, aligners. So we try and be as comprehensive as we can to ensure that we get a really good patient feedback.
Lovely. But I'm curious to know, Neil, how did you guys meet?
Oh, that's a long story. So I always wanted to do my master's, but not in India, somewhere in Europe. But the programs in Europe at that time were not allowing me to continue my practice. So one fine day, I found this program online, which was giving me a master's degree in a year by just visiting Europe 3 to 4 times. And I registered for that. And unfortunately, COVID hit. Right, and that we were about to begin the program. I think the COVID hit, and the program shifted online. So we had a couple of sessions online. I think it was in March. I think the first session was in February or March 2020. The COVID just hit and the program started. And then as COVID eased out, they had one session in Tirana, because that Albania. That was the country that was allowing Indians and people all over the world without any visas. So they decided to conduct one session there. And that was the program where both of us met. And believe me, during that time, we hardly interacted. We were there for a week and, we were just interacting very dentistry, but not as friends. We were always talking dentistry and, and in the evening, we would just go out for some shopping and food and walks. That's about it. But that is where I met him. It was an MSc in oral surgery and implantology. University of Rome.
Right? University of Rome.
That is where we met. And from there, this is about 5 years back. And this is the 5-year-old story.
Yeah, and I think we've been keeping in touch on and off over that 5-year period and just kind of, because similar profession, we do similar clinical treatments as well, don't we? We both have a passion for dental implants. And so since doing that degree, that relationship kind of flourished into friendship, I'd say now. And first time we're actually physically meeting in Mumbai. I didn't get to see you last year when I came. But it's nice now that every time I come Mumbai, we'll hopefully get to spend some time together.
We never knew that a course like that would develop a friendship like this.
Exactly. Yeah.
Someone practicing in UK and now visiting India. How do you compare the dental and the medical ecosystem in both the countries?
Yeah, from a UK perspective, there's 2 main ways patients can access dental care. And that is government funded, which is the National Health Service, NHS dentistry, which the predominantly of dentistry in the UK is done from government funded dentistry. And then the other aspect is private dentistry, and that can be funded usually by the patient themselves or through insurances as well. And the biggest growth in UK is the private side. However, the government is trying to do more and more for the economy to try and provide more dental care for the citizens of UK. Coming to India, it is all private from what I see there, and correct me if I'm wrong.
There is no funding by government or any insurance companies. So everything is funded by the patient himself. So I think that's one of the biggest difference between dentistry in UK and India.
The choice to be private in UK is a choice, but you can have government funded. And if you're if you're struggling to pay, the NHS can fund it for you. So you are eligible for free treatment within the UK for general basic dentistry. Cosmetic treatments will always be provided from a private perspective. But the emphasis on healthcare and dentistry, I feel, is much greater in the UK. Patients regularly attend in general compared to here. And I think compliance from patients with oral hygiene is higher. Correct me if I'm wrong.
Yeah, and I think again, UK patients are a little more aware of their dental problems than what we see in India. I mean, my team will agree that patients still come to us at a point when they can't eat or they are in severe pain.
Yeah.
In UK, I think people still come for smile corrections when
Yeah.
they don't like the smile or crooked teeth. That happens in India only when they're children.
I mean,
Correction for
talking
smile.
about my own family in India, my cousins and some of my uncles here, the concept of seeing the dentist every 6 months, they can't fathom. They don't get that you have to see a dentist every 6 months or every 12 months. You go and see a dentist when there is a problem.
Correct.
In the UK, a good percentage of patients will come every 6 months for cleaning as a minimum. Even if they've got perfect teeth, they'll come for their cleaning and hygiene.
So that concept has never picked up in India, and I don't think it'll take another maybe 4 or 5 years, maybe still, for it to pick up.
So would you think that AI or social media are doing any good or helping awareness in terms of when to visit? Is social media or AI?
I think in terms of that regular patients coming to practices in the UK is a government funded thing. So they've already promoted that you should be seeing a dentist every 6 months. And so people don't want to lose their government space, so they will come regularly. So the concept is very different because from a young age we're there. But I think certainly social media and AI, the more we as dentists can be on social media and speak to patients in their tone, and so they understand what we're saying, then the likelihood is they were more approachable, so they're more likely to come.
Yeah, I think he's right. We need to be on social media. I think it's the need of the hour now.
Yeah.
Otherwise, how will people know that what you are capable of?
Exactly.
And I am still a little anti social media, and you and the whole team, they are literally forces me to come to reels, do the reels. But it's okay. Now I understand the importance, because now when patients come and tell us, and then the kind of awareness we are generating, I've seen a huge
I was
difference.
the same. I hate to doing all the social media stuff, but again, my team has forced me to do it, and so now I'm on the camera every week now. So
I think it's the mindset. I think we are a similar age bracket that we don't want to do that. We are happy doing our dentistry, happy doing our work.
Exactly.
And giving what works for the patient, and let the younger guns handle that.
But you're right. I think patients knowing what we can do is very important, and informing them, and the importance of coming regularly is powerful. In terms of AI, we already kind of use a lot of AI with our digital dentistry. So when we're planning our smile makeovers, that's planned by AI. We can have a picture of the patient, of what their teeth could look like, that the AI will generate. So it's more, again, tangible.
Clear vision, and then they can see how to do it.
Exactly. And I think 4 or 5 years ago, we didn't do that.
No,
and so
nothing.
we would be explaining to a patient, we can make your teeth look nice. Your teeth will look good, your teeth will look good, your teeth will look good, just by telling the patient. Now it's like, no, here's your face. This is what you look like. Is this what you want?
You like what you see, then just go for it.
Yeah, it's much easier.
And it's easier to sell as well, right? It's much easier to sell.
Yeah.
So what is that one dental myth you think the patients always have an issue with?
I think you touched on it, is the fact that once we do dental treatment, say you had a dental implant or you've had your braces, the expectation is that treatment's done, never need to come back and see the dentist. That is the myth. Everything needs maintenance. Everything can fail. We're dealing with biology, and biology can go against you in your older age. So things can last for life, but maintenance is important. And coming to see the dentist every 6 months as a minimum is very crucial. And having hygiene and cleaning is very, very crucial to make anything last.
Yeah, as you rightly said, patients feel that once I've done an implant, now it's going to last me for the rest of my life.
Yes, yeah.
That's the expectation. It's not true. Ultimately, it's a device which we as dentists have implanted in the jaw. We are not gods, right? We can't mimic what nature has given. So the patient needs to come back for regular follow-ups, clean-ups, whatever he has said.
Just a basic thing.
Yeah, that's such a simple thing. Yeah, that's it.
Rest,
yeah.
Leave it on the best.
Like in India, patients do implants and treatments and they are away for 4 years,
Yeah,
5 years,
yeah,
6 years. Suddenly one fine day they'll come, "Arey, my bridge is shaking, my teeth are shaking."
And by then it's too late.
How is it possible?
Yeah.
You did implant.
Yeah. It's like almost too late. Sometimes you come
Yeah.
regularly, we can pick it up
Yeah.
and tweak things and
Correct.
change things. And so yeah, I think that's the biggest.
So what is it that drew you to the specialty?
What drew me to implants?
Implants. So whatever your specialties, be it,
Yeah, what drew me to
Invisalign.
implants was when I was in dental school. Anytime we did any surgery or maxillofacial surgery, I love those clinics. The excitement of doing surgery, the excitement of being able to use a scalpel and take teeth out. That was always exciting for me. So I went on to do a 1 year maxillofacial training at one of the biggest hospitals in the UK in Birmingham, and that affinity to surgery was what sparked me. And so when I finished that training, the choice was, do I do maxillofacial surgery or do I go into practice? And at the time I was getting married.
Yeah.
So money was very low.
Yeah.
Big wedding to pay for. So I tried to get the best of both worlds.
Best
Earn some money in practice. So
Correct.
we bought a practice and then trained to do oral surgery and implants. And so
Correct.
my passion of surgery then flew from
I
there.
think we spent a good 16,000 euros.
Yes, yeah.
That's massive amount of money, right?
Yeah, exactly. Yeah.
I know.
So what drew you for your?
I always wanted to, give something to the patients which will make them smile. And in India, we see this problem mostly in the senior citizen, and that is where the implants are needed. So, at that age, those senior citizens generally they then just get aloof. They don't eat. Their social life goes for a toss. So the pleasure and the this thing which I get, the happiness when I see that patient enjoying the social life.
Yeah.
Once we have the implants, is immense. So that is what drew me to dental implants.
Yeah.
Yeah, I don't know about UK. No, how in UK,
I think
how
for me,
aloof they become, or how much they avoid their social life because they don't have teeth.
Yeah. It's key to everything, isn't it? Your professional life, your just in general in relationships, having good teeth is important. So for me, the implants wasn't purely any smile makeover case that we do that involves either implants, crowns, Invisalign. They're always the most exciting cases where you're taking a smile and changing that patient's almost personality changes overnight, and their confidence increases. And you see a patient start of the journey, head down, don't want to show their teeth, end of the journey, smiling, new hair, new makeup,
absolutely.
Sometimes new wife, new husband as well. So I think it's always interesting, isn't it, to see how people change.
You see a new patient altogether.
Yeah, it's a new person.
At the beginning of the treatment,
it's a different person, and that's amazing to see sometimes. It's a transformation.
So you would see patients on a daily basis. So would that be any particular patient which have stuck to you emotionally or professionally? A case of a practice or something that would have really stayed emotionally or practically?
I think for me, because we do a lot of sedation, so we do a lot of sedation at our practices. It's those patients that are really scared. So the one that really struck out for me is there's a patient that wouldn't enter the front door of the building, that scared. And so then I had to walk outside the building, speak to her outside on the street, to calm her down and say, look, all I'm going to do, explained what I was going to do on the day for the consultation. And we walked in together and I did the consultation. She felt relaxed, calm. And then at the day of when we were doing the treatment, again, I had to take her back because again, she was really, really scared. We brought her back in from outside, brought her into the chair. We sedated her, did the treatment, and that transformation. She had not seen a dentist since she was about 40, and she hadn't seen a dentist since childhood. So her teeth were very bad, and she went on to have a full set of teeth, full set of implants. But to get to just that stage of her having dental treatments, it's just blown me away. She now comes regularly. She doesn't see me anymore. She sees any dentist, any hygienist. So from coming off the street to now seeing any of us, I think that is a life change, isn't it?
Yeah, I mean, sedation does do wonders. We just introduced sedation into our practice.
Yes, brilliant.
And we have seen some amazing results with sedation. I mean, patients are so happy at the end of it. but the case which has stuck to me now, recently we just restored a patient. I just showed you that.
Yes,
X-ray.
yeah, very impressive.
And
yeah.
that patient was in a horrible situation for last 3 years, for not able to eat, not socializing, and avoiding any kind of food, can't even eat something like rice. And when we gave her teeth at the end of it, she was so happy. She got so much of snacks for all of us, and she almost
Yeah.
threw like a party at the clinic.
Yeah.
And the smile which we saw on her face was unbelievable.
Well,
That smile will remain with me for the rest of
I
my
think
life.
having looked at that case, there's very few clinicians that can even do that treatment.
Yeah.
So well done. That was an
Yeah.
amazing case.
Yeah, it was a real tough one. And when
Yeah.
we were treating, I mean, Komal, Shiksha, they were all like, sir, what are you doing? Neel, what are you doing? I mean, how can you do this? I said, don't worry, we'll do something. So I knew I had somewhere at the back of my mind, I will be able to do something for her. And I'm happy that we could, help her out more than anything
Yeah.
else.
So do you imagine yourself doing anything else besides dentistry? If dentistry was not a career, then do you see something?
Well, yeah. It's what would I do if I wasn't a dentist? If I truly wanted to do something, I would love it would be an archaeologist. I'd like to be Indiana Jones and travel the world, find ancient treasure.
Yeah.
That would be my true dream. But would that ever happen? I don't know. Don't think so.
You know me for last 18 years, and I think the answer is very clear. Yeah? And I would have been a travel agent.
Travel agent.
Yeah.
All our travel plans is
Yeah.
always like you want to go on a
For
holiday.
sure.
And it's
Yeah,
always
For
okay.
sure.
From start to end.
More than a travel agent, I would be running a travel company.
So now let's have a little fun in terms of I'll ask each one of you rapid fire questions. First you and then you, okay? And the best one gets a hamper.
Oh.
Gets a prize
Oh, we are
hamper.
fighting for something?
Yes.
Yeah.
So this is gonna be a very rapid yes or no, right? I mean, what's more stressful? First, we'll go with you, Amit. What's more stressful, broken file or non-integrated implant?
Broken file.
Which kind of patients you prefer? Patients who say, I don't need medications or I have high pain threshold, or patients who say, Google told me I don't need a crown?
Google told me I don't need a crown.
So on a scale of 1 to 10, how much would you prefer filming these documentaries or podcasts?
I love it. So yeah, 9, 10.
You're getting very familiar with the...
Yeah, I've got used to it now. So yeah, I'm doing it now regularly. So.
And your podcasts are really doing well.
Yeah.
Really enjoying them. If you had to swap clinics for a month, okay, you come to Ashar Care, what would you miss more? The patients over there, the staff?
The staff. Definitely the staff, yeah. Patients as well, of course, but yeah,
The staff.
I'm very, very close to my staff. So.
Who was always late for the lectures in Albania?
You were never late, were you? So yeah, it was me. Yeah, so yeah.
What food would you prefer, Indian breakfast or English breakfast?
English breakfast.
Yeah.
One piece of advice to the young dentist.
Take up good mentorship. Don't rush, and take up very good mentorship and learn slowly, not fast.
Oh, okay. That's a nice one. Okay.
I think give the hamper to him. I don't want to answer any of these.
You're not the one to give up, right? I'm sure you're gonna fight. 10 questions goes to you. First one, what's more stressful, broken file or non-integrated implant?
Non-integrated implant for me.
So why I said that is like non-integrated implant, I know I can fix.
I know there is a solution, but with a broken file, I know I can remove the tooth and place an implant there.
True.
But implant is not integrated, we don't know what's going to happen.
So never to get stressful, right? There's always a solution.
There's always a solution, yeah.
What kind of patients you prefer? The Google one or the overconfident one? I don't need.
No, the overconfident one. Never the Google ones.
On a scale of 1 to 10, how much do you prefer filming these documentaries and
2.
podcasts?
2. We'll get you to 8 soon.
If you had to swap clinic for a month, the staff.
I think the
or
staff.
The patients?
I think the staff. Definitely the staff. No, my patients would miss me more. That's for sure. Yeah.
The
but I would miss my staff and my team.
They would miss you too.
Yeah.
I'm sure. Who was always late for the lectures in Albania?
I am always punctual.
Yeah.
What food would you prefer? Indian
Indian breakfast
Yeah.
anytime.
Indian dinner for me, but English
Indian breakfast for me anytime.
One piece of advice for the young dentist?
So I think in my fitness terms, I would say dentistry, a dental profession, is not a sprint but a marathon. And you have to kind of keep at it all the time. You cannot give it up in the middle of the journey, and it's a learning process throughout your life.
Mm.
You can't say that now I have reached a state, or rather Amit or me can't say today that we have reached and now we don't need any more education,
Yeah,
or we
yeah,
don't
yeah.
need to do anything more, like that.
This never stops.
So I think it's an ongoing process which we have to keep evolving all the time. That's one piece of advice I think I would give to all the young dentists.
That's a nice one. Now it's in a difficult spot, but since it was a rapid fire, okay, I guess we have a winner here.
Thank you so much.
Congratulations.
Congratulations.
It was
Thank
Hope
you.
you enjoy all
Thank-
the goodies.
Wow, look at that. Yeah, looking forward to it.
Yeah.
Trying to think what am I going to eat? I'm going to eat all of it.
Yes.
Thank you.
So
And I guess we can kind of have.
yeah, it was a pleasure having you, Amit.
No, it's a pleasure to come finally. To
Though
New
the
York,
trip was
so
very short and we
Yeah,
hardly got
yeah.
time. So next time I think
we'll
you'll
try and do something longer. Yeah,
and next
definitely.
time please be sure
Yeah.
we are with Mamta and the
Yeah.
kids, and we can have a small holiday as well
Yes,
together.
yeah, we will.
It'll be fun, all of us
Yeah.
together. Right?
Looking forward to
And a
it.
small gift from my side.
Oh, very good. I've not
Yeah.
got this one. So
Since you are in the expanding mode, I
Yep.
think this book will really help you on how to grow bigger.
companies that choose to be great instead of big.
Yeah.
Very good. And surprisingly, I've not read it. So
Yeah.
yeah, looking forward to it. Thank you.
Yeah.
Enjoy.
Perfect.
I hope-
Thank
Perfect.
you so
Thank you
much.
so
I hope
much.
that you become a big giant in UK very soon.
No, I will always be small.
Yeah.
But think bigger.
But I always
Yeah.
think big. Yeah.
Thank you so much.
Thank you
It
so
was
much.
really
Thank you so
lovely
much for
having
Thank you.
Thank you.
Yes,
Thank you
thank
so
you
much.
so much.